If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
Hey man, how's it going?
It's going well. In the middle of summer, we're getting to the end of World Cup, and I don't know, I feel pretty good about it.
Yeah, I'm in Asheville, North Carolina today. It's pretty hot. I think
it's hot everywhere now.
Yeah, it's definitely hot here, but it is pretty. The hills are really pretty here. I did a keynote this morning at the North Carolina Healthcare Association meeting at the Omni Grove Inn. It was really a great meeting, great group, and I always love the opportunity and appreciate the opportunity to share a little bit of what we talk about on this podcast every week with the leaders of health systems around the country. So it went well.
What's the feeling like after? Like if you talk to people around, are they still surprised by what you're saying, or are they all experiencing it now? And it's
what I try to do is I try to bring aspects of what is happening to healthcare that you would never get from like modern healthcare or you would just typically never see on any conference stage, just things you wouldn't see. And I will tell you, this is like my 7th or 8th time doing this talk. Every time I do it, it's something like 2% of the audience actually knows the storyline that I'm sharing. It ends up being like a very big download of information. It's like a 55-minute talk, and it's pretty full of information.
Right.
And it's
but it's only, there's a few random 2% that are outsiders, or maybe they came from another industry or something, but most of the core folks don't know this.
So there's always one or two people who will come up afterwards and be like, "Oh my God, thank you so much. Like, I listen to all these podcasts. I know exactly what you're talking about." It's, and then they will say like, "This was really helpful for me because I struggled with how to communicate these things inside of the organization." Right. Look, I empathize because these hospitals around the country, it's like the boards are community led, as you know.
Right.
And so the difficulty of what is happening to these institutions financially versus the moral charge that they have from their community led boards, those are really in conflict, man. You know what I mean? Like, we talk all the time about how some companies just need to go private because the public market is not the place for them to deal with, the turnaround work they need to do. A lot of these hospitals have no escape, right? How do you escape from the community you're there to serve?
Right.
But like, really, they need a lot of them need some very serious work to kind of navigate the present and the future as it's laid out. So it's a challenge. It's a big challenge.
Okay. Well, I'm glad you're doing it. Someone's got to tell these people where else to look.
So. It's a great honor, honestly, to do it. Every time I get to do it, I'm always just like, I feel really fortunate that, I get to share this information, with folks. So, okay. And then, as far as the World Cup final goes, other than the storyline of Messi and, Lamine Yamal, I don't think I could be less interested in a World Cup final, which is sad because it is the number 1 and number 2 teams, right? I mean, by rankings. I mean, so it all played out the way it should, 1 through 4.
People were worried about expanding the field and what would happen. And we got some great Cinderella stories in the early rounds, but it ended up that the dominant teams remained dominant.
It all ended up playing out exactly to the FIFA rankings, which is actually a remarkable seal of approval for the FIFA rankings, right? I mean, like that really is. Now, I think that there's a whole nother conversation to be had about some of the issues around how countries can improve their access to high level competition so they can ascend in the rankings, right? So it's like, for example, it's really, really difficult for any country in Africa to like get playing time against European teams. Like they just can't do it. And if you can't do that, then you're kind of capped at your level of competition.
Yeah.
You know,
Right.
and I think we sort of got a sense of that, right? I mean, if the only time you're ever going to do this is once every 4 years, that's a challenge. That's a challenge.
Yeah. Well, I mean, I think even in America, where we have, close to unlimited money and a lot of people, and it's one country that is, well, we have our differences, but it's all one country. It's hard to do it here.
Yeah. Yeah. I mean, here we look, we have some just very clear fundamental issues around pay for play. It's still just not the dominant sport at all, right? I mean, there's still
right.
football, basketball, and baseball ahead of soccer, right? So there's just a million reasons why it falls where it falls in the United States of America. But for the rest of the world, soccer is the number one sport, right? I mean, like there are all these other countries where it is the number one sport, and so.
Well, I just meant the impact on MLS has been importing talent, like Messi and others from elsewhere, and you can't do that unless you have oceans of money. So Africa is not going to be able to do that. Yeah. Right.
No, that's exactly right. Yeah, and Africa does not have a global platform of influence, right? Like it doesn't have Hollywood, it doesn't have Apple, it doesn't have, you know what I mean? It doesn't have Amazon. So it doesn't have the ability to like Netflix, it doesn't have the ability to like export culture in the same way that the United States does, right? So yeah, all things true. I will be watching it, but like I would have been happier with a more I don't know, unusual final. All right, having said that, we got a lot to cover, so ready?
Yeah.
All right, let's dig in. Starting with CPI, consumer prices rose 3.5% annually in June, less than expected as energy prices eased. So the first good news in a while on the inflation beat, and it certainly gives Chairman Warsh a bit of breathing room as things tick up with the war in Iran and the midterms.
Yeah, that's right. And it fell, for the first time in a long time, maybe 2 years or so. So great news. It's going to be temporary because the war has kicked back up again. But for the moment, inflation seems to be okay.
Yep, great. So I've just seen so many different takes on what's happening in the labor market. And it seems to me that the AI side is really heavily talking its own book, right? Trying to sort of make this case that we're not actually losing jobs due to AI. In fact, it's going to be a net job creator, et cetera, et cetera. But I'm starting to see more and more people say, hey, this economy is really, really hard. I know so many people who are out of work for a long time. I think I said it last week on the pod. It continues to be a theme in my life personally. And so I was really glad when you found this story here from the Wall Street Journal. 2 million workers are locked out of an improving job market, right? So I think we need to find a more nuanced narrative around what is happening. Because I do understand that there are jobs opening, and obviously healthcare is a net increaser of labor. But it's also true that a lot of people cannot find a job right now. And this story is sort of covering those people. So the share of employment has barely moved in 2 years. And the share of unemployed people out of work for at least 27 weeks has been, steadily climbing for the last, 2 or 3 years here.
This is the figure that I think is the best signal for the risk of future recession. Is that not so much the immediate unemployment, because there is changes going on all the time. And I mean, take AI, for instance, it may be true that it creates jobs, but it's definitely going to be true that it also, there's a lot of churn where people might lose a job, they find another job. And I think that is always going on in the economy. But this long term, you've been out for 27 weeks, basically half a year. When that starts to clip up, that means that people are looking for a job for 6 months and they cannot find anything. And historically, that has been the most reliable signal of sort of a impending recession. Not so much our jobs changing, but that they can't, once you lose a job, you can't find somewhere else to work. It gets really difficult.
Yeah. So
it's the worst it's been since 2021, which is 5 years ago now, a long time ago.
Yeah. Yeah, and think about what was happening in 2021, right?
Right.
All right, moving on to VC deals. We've got 2 today, and they are big. Chai brews up $400 million Series C to fuel AI molecule models used by Lilly, Novartis, and Pfizer. This is from Fierce Biotech. More in this theme of AI supporting drug discovery for big pharma companies. The third financing round in less than a year to bring the total funding for this company to $600 million. It's just incredible how much these pharma companies are consuming these specialized AI models.
Yeah, I mean, there's just a huge greenfield of potentially really valuable new ways to design an antibody, for instance, or a new protein, or that we have never sort of seen in nature, but could really be effective. And AI is turning out to be the way you sift through those millions, maybe billions of combinations to find the ones you should really look into more. Huge potential, and Chai is one of the leaders in that.
Yep. And then the second story, Neko Health secures $700 million to support their U.S. expansion. This is a Series C. It was led by Lightspeed Ventures and OG Venture Partners with participation from General Catalyst and Lakestar. It's a health tech company. It's going to be delivering a product that does a health assessment, analyzes skin health, pre-diabetes risk, and blood abnormalities. And it's expanding from Sweden into the U.S. So, very, very large round, really, really strong partners. And I hadn't heard of them before, so I think we will be hearing about them more in the U.S. with this significant round of funding.
Yeah, and they're really focused on all of the metabolic symptom dysfunctional heart disease, diabetes, kidney failure, all of those chronic diseases are what they're really focused on assessing and measuring. And those are huge problems that if we can catch earlier are much easier to solve. There's still a challenge, but so super excited about them coming to the US.
Yep. All right, moving into policy. The doctor pay is about to drop in 2027 under proposed Medicare pay rules from Healthcare Dive. So we're looking at a drop of 1.68% for doctors who don't participate in alternative payment models and 1.19% for doctors who do. So not really a carrot and a stick, more like 2 sticks, but one stick is a little bit heavier than the other. And also I think continues to point in the direction that CMS is really interested in driving different ways of doing business. And so, less punishment for those who adopt alternative payment models, perhaps. There's a quote here from Jerry Penso, who's the president and CEO of the American Medical Group Association, and says that these updates fall well short of what it actually costs our members to deliver care. So seems like just more hits coming out of CMS.
Definitely. I mean, they're applying cuts to reimbursement or reductions in the growth on every front. And I think there's less room to make changes in a physician group. Like a health system has many different parts. They can try to make changes in one place to help somewhere else. Physician groups typically don't have that kind of latitude. Their costs are reasonably fixed. I mean, they have real estate, they have people, and those expenses are going up. And so reducing their payments is going to be really painful.
And Senate Republicans kill the bid to end Medicare prior authorization pilot. We're talking about WISER, which is the wasteful and inappropriate service reduction model. So we've been talking about this for the last month, and we saw it sort of pushed out there. That we saw that there was some suits and some blowback, but it looks like Senate has voted to preserve it, and so we're going to see this rolled out. It's going to add prior authorization to some Medicare services in 6 different states. It's almost certainly going to have the effect of delaying seniors' care and creating some more administrative work, because that's what kind of prior auth does. But again, this is more proof that the Trump administration and the Republicans are very, very serious about curbing the healthcare expense of the country.
I agree with that. And this is just another sign to me that the Democrats need to find a way to have a response to fraud, waste, and abuse. I mean, it is not defensible to say, we don't need to focus on it. Instead, I think they need to really try to find a way to solve some fraudulent cases so that they then have the credibility to argue that in Medicare, some of these treatments, maybe they're expensive, but they really help the seniors. And so I feel like we don't have the Democrats really even in the game speaking in a way that is credible, which is unfortunate. And I'd like them to change, but no one seems to have so far.
Yeah, I think I will actually agree with you on this point. And I don't want to do whataboutism, but in this case, I think we have to sort of look at what strategy will actually give them more defensibility and more moral high ground. Obviously, they are arguing, against a just barrage of different policies that are going to drop the number of people that are insured and decrease access to care. And I certainly do recognize that this is yet another one that will have that same impact. Putting all of that to the side for just a moment, I do agree that the Democrats need to find a way to be associated with taking a stance against fraud, right? So they need to not allow the Republicans to hold the position that they're the only group that is against fraud, right? And right now the Republicans have managed to sort of capture that line. And so I agree. If the Democrats want to, neutralize that as an argument, they're going to have something that is on the front foot on that topic. I agree.
Yeah, because defining what is wasteful is really where I think it's important. I mean, fraud is fraud, and I don't think no voter wants fraud. But whether a payment to seniors to get some treatment is appropriate because it's going to make savings apparent or make the quality of life better is a judgment call that I think we need both sides of the aisle to get to a good answer. And so that's where I think the fight should be. And when they just not willing to talk about any of it, I think it makes it difficult.
Yeah. So I agree. It's a nuanced thing you're talking about there, but I catch what you're saying, and I do agree. Okay, moving on to payers. UnitedHealth Group raises their 2026 guidance again as cost controls pay off in Q2. This is again healthcare dive. Profit spiked to $5.5 billion in the second quarter thanks to notable earnings recovery in its insurance and value-based care delivery businesses. So there was some positioning around what would happen in Q3 and Q4 that I think was maybe a little bit less optimistic. But generally speaking, UHG continues to show that they are weathering the storm and making the turnaround that they need to after a very, very tough year and a half in 2025 and in the back half of 2024.
Yes, I agree. It's been maybe a year and a little more since Helmsley came back, and I think he's turning the ship. Okay.
Yeah. Elevance Health previews Medicaid exits as profit slips. So they did not have quite the same results as United did, but I really want to focus on them talking about, scaling back the Medicaid business. We keep pointing to all the exits that the payers are doing across different lines of government business, whether it be Medicare Advantage or ACA Marketplace. And now we're seeing, really sort of the monster in the blues, Elevance, say that they're going to back away from Medicaid. I mean, Vic, where is this going to lead, when all the big payers are just backing out and saying that they don't want to do the government paid business anymore?
I mean, nowhere good. It's not functional to have very few Medicaid kind of providers. So the states will still do Medicaid, but it's going to be hampered and not as efficient. There won't be competition. There won't be the same sort of pressure on making provider networks that are robust and cover everything. It's just going to be bad all around.
Yeah, I mean, there's more stories around this coming up when we get to the provider side. But let's just wrap up here in the payer section with CVS Caremark reaching a settlement with the FTC over an insulin suit. And this is, really around more of the PBM stuff. They basically, the FTC was able to get a bunch of different concessions around lower costs, around Trump RX being included. I just think it's a drumbeat here that the government is going to neutralize the profitability and the effectiveness of these large vertical, payment platforms leveraging PBMs as profit machines. It just seems to be a never-ending process where we're just going to see more and more and more of this.
Yeah, no question. The existence of a PBM with a limited formulary driving price concessions and high profits is might already be over, but it's ending quickly.
Yeah, it's just a lot. Moving to providers. So this is sort of the other side of it, right? If we've got all these payers dropping out of government pay, so let's talk about the Affordable Care Act and the marketplace. As plans drop out, the plan quality gets worse. As plan quality gets worse, and also we've talked about how multiple years in a row now we're going to have double-digit increases. People are just opting out of these packages entirely, right? And as that happens, that reduces the amount of covered lives that can actually be, that can go into hospitals and get their care paid for. And so here we have HCA cutting 2026 earnings forecast on insurance coverage loss, that they're going to lose $400 million in the second quarter against what they had actually projected. So instead of $6.7 billion, they now expect between 6.3 to 6.7 billion, compared with previous guidance of 6.5 and 7 billion. So that's a pretty significant swing. And again, it's because of the ACA is just crumbling, right? I mean, without it being banned, it's being made unviable, right? And I don't really see any trend around that changing for the next 12 to 18 months. So, if HCA can't navigate this without having to restate, what is hard for HCA could be ending for most hospitals, right? It could literally take them out of business. And I just think that this is a very, very bad sign for health systems overall, that HCA had to sort of, retrace their steps. Now, they're very good about getting out in front of bad news and making sure that they take their losses up front and then, under promise, over deliver in the future. So this is a consistent approach of how they communicate with the market. Having said that, they're very disciplined around that. But having said that, it doesn't change the fact that they are restating their projected net income.
Yeah, no question. ACA, and then we have discussed at length a little while ago, I talked about it with Medicaid. HCA does not have as much exposure to Medicaid, but those two government programs are really going to bring a lot of pressure on health systems in the next 12 to 18 months. HCA losing $400 million, and then I think it was $1.1 billion over the next 4 years. I agree with you completely. There's a lot of health systems that cannot withstand that. And HCA is very well run. And so health systems that are not, managed by the same operators that HCA uses, they may have slightly worse outcomes, and they're not going to be able to sustain these kind of changes. So yes, it's, I'm a shareholder of HCA. I'm not going to sell. I think they'll be okay. But there's a lot of pressure on health systems broadly. And I think you're right. The canary in the coal mine here is going to really signal that other health systems, like the ones you just talked to in North Carolina, are going to be under a lot of pressure.
And then, we talked about HCA and the fact that we're not really worried about them, right? I mean, they're incredible operators. They're great at navigating this kind of stuff. They've got incredible technical capabilities, really strong balance sheet. At the end of the day, we're talking about a decrease in net income. We're not talking about like going margin negative. Mm-hmm. But there are a lot of hospitals that are in a much worse situation, much harder margin compression, much worse payer mix challenges. And one of the things that HCA has is it's got a pretty robust ASC network, right? So here we have a story from Becker's Hospital Review that is basically summarizing the latest report from Kaufman Hall, their National Hospital Flash Report. Their key findings here are that outpatient revenue per calendar day increased 8% year over year through May, outpacing the 5% increase in inpatient revenue. And at the same time, adjusted patient days rose 1%, while inpatient discharges remained relatively flat. So this is basically outlining that we have a shift away from traditional inpatient care. And so I've been starting to have some very direct conversations with people asking, what is the future of the hospital? Not the health system. The health system, I think we understand. Health systems can end up diversifying their portfolio of assets. They can have freestanding EDs, they can have behavioral health, they can have ASCs, they can have urgent care, they can have primary care clinics, they can have specialty pharmacy, they can have
imaging,
oncology, imaging, exactly. They can have a diverse array of assets that integrate very nicely, that offer sort of the best side of care for a patient. And also, great data sharing and referral patterns that are very, very strong. But the hospital itself is very clearly under attack. And hospitals that are not part of these broader, diverse portfolio of assets, I think are really, really challenged for reasons we've been chronicling over the last, 3 years of doing this podcast. And not everybody is going to get to build out an ASC network. There's just not going to be that many of them around. You think about what an incredible move it was for Ascension to get AmSurge, right? Because it's like, that's just such a fantastic asset. It was coupled with the wrong thing for a little while there, right? But now, tied to a really high quality, high performing health system, it's going to be, of strong mutual benefit. But everybody's not Ascension. Everybody's not HCA. Everybody's not Tenet. Everybody's not going to be able to build or even buy their own ASC network. And this is what really worries me about hospitals, in the next, 3-4 years as HR1 really starts to ramp up.
Yeah, no question. I mean, I think there's two related things in the same direction. So volume is shifting out to the ambulatory side. Patients would prefer not to go into the hospital if they can get the same service closer to their home. That trend has been going on for a long time, and I think it's accelerating now. But then almost more related and more important is the advantage as far as reimbursement per procedure is disappearing, where you're getting now much more parity between what it costs, which is effectively a reduction in the difference in what a hospital is reimbursed versus an ASC. And I agree. There aren't that many more places you can put surgery centers, diagnostic centers, physical therapy centers. They're already built out significantly, but more importantly, it takes capital. It takes development, management talent to partner with docs and get them set up. And a lot of the smaller health systems, they simply do not have the balance sheet to do these things. And even if they do scrap together some capability, it's pretty hard to get oriented where you can get a partnership with some physicians and get it and put in place. It's hard to do very quickly. And so I think at the same time, Becker's is right, and it's hard to make a change that would be meaningful in the time frame that they have available to them. So I don't know, I'm pretty worried about it.
All right, let's move to pharma. Another week, another Lilly acquisition. Actually, it's been a few weeks since we've had a Lilly acquisition. They gave some room for the other companies to catch up and buy a few things.
Yeah. I talked to one of our friends at Lilly this week, and I learned they take the entire week off every year for 4th of July. Everyone from David on down. So maybe they just, they had a week off. So now they're back and they have another acquisition.
Okay. Well, yeah. I guess that's kind. Let everybody take a break. Take a week off, and now we're back at it. Get back to buying stuff. Right. So, MedCity News headline: Lilly expands its mind to psychedelics with $2.8 billion Atai-Beckley acquisition. This marks a dozen M&A deals for them so far this year. And this one is a little bit interesting because this company, Atai-Beckley's lead program, is an intranasally administered psychedelic drug and a pivotal testing for treatment-resistant depression. I did not necessarily think that Lilly would be getting into the psychedelic business. I understand psychedelics are often focused on treatment-resistant depression. But this, to me, is a huge validation for everybody that's been advocating for, more advancement in the psychedelic drug space. Because if Lilly is making a purchase, I immediately take it much more seriously, and I think Wall Street does too.
Yeah, no question. It's a huge problem, and the intranasal delivery is pretty interesting because it gets around the whole gut enzymes. A lot of medicines can't and this medicine can't really survive that. And the results were really impressive. So, they have a durable positive effect with a single dose through 3 months with really no serious side effects. And so really promising. And I think Lilly is expanding at all fronts. So behavioral health and depression is a really difficult space, and psychedelics is an important piece of that.
Yeah. So congratulations to Lilly and Atai Beckley on this acquisition. This, very exciting from Merck. The FDA approves a first-of-its-kind cholesterol pill, ushering in a new wave of treatment. So for anyone who has been tracking the war against bad cholesterol, there's statins, there's sort of the old school, like izitembe's, old school cholesterol drugs. But then there's been an emerging group of drugs called PCSK9 inhibitors. And they basically, interfere with the body's ability to clear the bad form of cholesterol. This is the protein PCSK9. And so there's been this rising use, especially around the concierge docs of these PCSK9 inhibitor injections. To really aggressively get after cholesterol. This is now a pill. So just as we've had GLP-1s move from injections to pills, we now have these PCSK9 inhibitors moving from injections to pills. And I think there's a lot of doctors out there that are going to shift from statins to this kind of pill. So I would project this to be a significant boon for Merck. And I wonder who else has got this in its pipeline. But I think this is incredibly positive news.
Yeah, no question. I mean, as you know, I'm really focused on, I think heart disease for me personally is important, but then we're having a lot of innovations that really are going to make a big difference. And this is an exact example of it, where I think the injections, like always, the injections are scary. People don't like to do the injections. It's much easier to take a pill every morning. And I think it could be separate. It also could be in combination with a statin. Getting your cholesterol down is a huge benefit to really sort of helping you live with heart disease and not escalate. So super excited about it.
Well, they were. I mean, listen to this. The drug is good. The drug is going to have a list price of $10.50 per daily pill, or $315 for a 30-day supply. Although they expect the insured patients' out-of-pocket cost to be much lower. Okay, and it's showing that it can reduce bad cholesterol by up to 60% over 6 months.
Yeah, that directly translates to your risk of a heart attack or second heart attack dramatically lower.
Yeah, period. It's fantastic. So Lipfendra, I'm sure we'll be seeing commercials for Lipfendra coming out here pretty soon.
Yes. Yeah.
And now maybe not so fun news. I guess we got to talk about Cyclospora. This whole outbreak, it's now has gone across 30 states. And I think we have to say, look, we have, I think that they've identified what might be the source. There was a lettuce factory that was providing a bunch of lettuce to Taco Bell. But Vic, is it just me, or does it feel like our apparatus for tracking these things has been impaired? like what's going on? We had screwworm, now we have this. We got measles outbreaks. We got outbreaks happening on military bases that didn't previously happen. I mean, why? This all seems kind of unnecessary.
Yeah, I think the prevalence of these kind of stories is increasing. So I believe that's to be true. I haven't done a study on it, but I think I'm seeing more of these stories. I think it's an environmental thing. Maybe it's global warming. Maybe it's more production in fewer acreages. I don't know what the cause is, but I'm not sure it's our apparatus to track it as much as I think it's more prevalence of the kind of these bad bugs of various types. Maybe not. You disagree?
Okay, but you don't. Look. It seems to me that there have been a lot of changes that have happened across the agencies of HHS, and the CDC is one in particular that for obvious reasons, was highly politicized post-COVID, right?
Yeah.
Very, very, very politicized, highly criticized for its handling. And I think in several ways, rightly so. But sometimes you throw the baby out with the bathwater. You know what I mean? Like sometimes you overdo it in acts of reform. And I just think that public health outbreaks, like these are things that in a superpower nation, we should have a very robust apparatus to defend against, to track down, to clamp down on. And it just seems like this is one of those areas where politics is getting into good scientific governance, you know?
Well, so I agree with that. I mean, I think we should be increasing our vigilance in checking our food supply, checking to make sure that infectious disease is caught and not spread. So I agree with that. I think that the prevalence is increasing at the same time that maybe our infrastructure is not as strong.
Okay, and I didn't mean to say that that's not happening. I don't have any evidence of that, and at the same time, I can certainly see how that would be the case, right? We're becoming a more complicated society, dependent on many different, highly centralized supply chains. We do a lot of mass production. We use a lot of chemicals. We're doing a lot of things here. So we certainly could have, everyone's flying all over the place. I certainly am flying all over the place. So there's lots of points of exposure and lots of points where outbreaks can happen. And so I'll give you that. I guess I'm just saying at the same time, our public health apparatus should be as high availability as our aviation apparatus. You know what I mean? It would almost be like not acknowledging that we've been having an increase in issues with air traffic control. And we are having an increase in issues with air traffic control, right? So to me, this is in that same category of we need to have robust infrastructure around maintaining public health.
I agree with that completely. Public health, in my mind, should not be politicized.
No.
It has been politicized, but that's wrong. We should take care of our public and make sure food is safe, make sure the air we breathe is safe. That is part of what our government needs to do. And it should be like, fixing the roads. It should not be politics. And yet it is. And I agree that we should try to stop that and add to the robustness of our testing system. And when something happens, be able to track it much faster than we are able to track with this.
Yeah. And 100%, our response mechanisms to this cannot be above reproach or above critique, right? That they should be constantly improving, and we should always have a feedback loop that is questioning how strong they are, right? That would be like having a critical bridge, and everyone just saying, just trust me, it's fine. You know what I mean? Right. Like, no,
right?
I'm not going to trust you.
Yeah, and it should not be a Republican or Democrat topic. Like,
no.
The safety of a bridge, the safety of my lunch today, it shouldn't be politicized. It needs to be safe for our people, period. And unfortunately, I think it has been sucked into that with the rest of the world. And that's about it. Yeah.
Yes. On a better note, there's a new wearable device that I'm pretty excited about. And I actually think, now turning to the other side of the coin, I actually think this administration is going to be very helpful for advancing. So it's called the Signal Ring. And this ring, Vic, gives blood pressure readings, which is novel. Right now, the Apple Watch will just give you alerts. It'll tell you, hey, your blood pressure is high, you're having a hypertensive event. But it won't actually read your blood pressure. And I understand like the likelihood of measuring blood pressure from something like a consumer device, like a ring. The quality of the reading is not going to be as good as if you were using, a proper blood pressure cuff. I understand that. But the availability of this data for people to sort of like track general trends for themselves. Again, we just had a conversation last week where we were talking about the efficacy of this data in a clinical setting. That's not what I'm talking about here. I'm just talking about making something that needs to be done regularly easier for people. Right now, it's quite difficult to measure your blood pressure every single day, and a lot of times people who have hypertension, that's what their doctor would like them to do. For 3-4 weeks, measure it every single day. I think having access to a ring that will actually produce readings that are of reasonably good quality is a great advancement, and I'm all for it. And I understand that the data is not going to be perfect, but having us move in this direction, knowing we are eventually going to get there to readings that will be pretty damn good, is really exciting to me.
Yeah, I agree completely. This is a really important health metric that people should be tracking, especially if they have hypertension or it's in their family. And it's very difficult to take a reading the old-fashioned way. So even though the traditional blood pressure cuff kind of process is more accurate, people just don't do it. I mean, I think the truth is you can't expect the population to be taking 2 or 3 readings a day for 30 days. It's just not realistic. And so this is, maybe it's not as high quality, but the value is some sort of aggregate of how likely are you to be able to collect the data and how accurate is it. And this ring will be far better in that sort of formulation in my mind. And then what I would like is that you take this information and you realize, okay, my blood pressure medicine is not keeping me where I need to be. And then you go talk to your doctor and you adjust your medications. And the readings do not have to be perfectly accurate to get that sort of general trend line and help the patient understand their health, which is what, at the end of the day, what we're doing.
Yep. Agree. All right, moving to Web3. Visa unveils stablecoin platform for banks and fintech companies. The Visa stablecoin platform will let financial institutions integrate stablecoin payments and treasury operations into Visa's existing network. This is from Decrypt. Can we just call it done now?
Yes. I think we are finished. It is, DeFi is now the mainstream.
That's it. I mean,
yes.
And I have to say, it's been, I don't know, a year since Genius Act, maybe a year. It only took a year for stablecoins to become a first-class product in traditional finance once we had legislation for it. It took 1 year. And honestly, how bad is it to have treasury-backed digital currencies that can be distributed around the world for the United States? I think it's very, very good for the dollar. It makes the dollar much more durable as the inevitable was going to happen. Crypto was inevitable, right? It was inevitable. And now that stable coins have had 1 year of clear Congress created, laws, Visa has now integrated them into their existing network. It's like this is the proof that the strategy of Gary Gensler and Elizabeth Warren was very, very flawed. You were trying to stop something that was never going to be long-term stopped. And ultimately, other countries were going to take a huge leap forward in it if we didn't do it. I continue to, and this is part of my talk that I do. So I'm a little hopped up on it because I was talking about it this morning at the North Carolina Healthcare Association event. But this was really one of the biggest unforced errors of the Biden administration. I don't think people really understand how bad it was that they pissed off the crypto bros. You know what I mean? It just was unnecessary.
Yeah, and I think I want your thoughts about, I think there's going to be a couple different uses of stable coins, and Visa's starting to kind of move in that direction where you might have large companies that have a stable coin and they're using it for internal bookkeeping, and it's a ledger account, and it sort of helps them with maybe subsidiaries in other countries. Or if you're a health system, you might have facilities all over the country. And instead of wiring money and moving money back and forth, you can do it much faster and cheaper with a stablecoin. And you may not be building a brand around the stablecoin. It may just enable Visa to do what they do already more easily. I think so. That's a new use case that I hadn't really considered before this and one of the Bankless podcasts that I heard this weekend.
Yeah. So Vic, I just want to say yes. And I think what you just stated is a very big part of what Ripple was supposed to do.
Mm-hmm. Right.
You know what I mean?
That's what Ripple is trying to do, a whole network. And you could use Ripple, but you also could just have your own stablecoin and you don't need Ripple.
Right. Exactly. To me, the stablecoin really, really impairs Ripple. Yes. You know, because I'm like, I don't know why. So anyway, yes, totally agree. And then, you know, as we've been talking about the last couple of weeks, but I think clarity is going to happen. You know, the latest prediction markets I think I saw, and it was like 65 to 70% belief on that it would go through. And as we covered last week, you know, Chair Selig said if it doesn't happen, we're just going to write the rules anyway at the CFTC and SEC level. So we're going to have.
And I think for a decent number of listeners, it's hard to understand why stablecoins matter, right? Because they're maybe not going to be trading in and out of other crypto coins. And so like some of the use cases that were early on are not that valuable to the mass market. And I think it's going to really change the way that payments are done. But behind the scenes, where like Visa and other payment networks are sort of much faster and either more profitable, or they can pass those savings along and they're less expensive, some combination.
I mean, Vic, claim settlement. Yeah. Clearinghouses.
Right. Yeah, I mean, we spend $1 trillion a year, and I'm waiting for the startup to bring me the healthcare payments network on a stable coin, but we're ready to do it. The infrastructure's there. So, you know, founders.
Yeah. Like someone do a deep dive on the current state of healthcare payments infrastructure. And then I think we'll have our answer about why stablecoins matter.
Yes.
Like there's so many parts of healthcare that's bad. We haven't really looked at that, but that's pretty much a disaster. And you know that there's a huge middleman in there just like sweeping cash in every single day from the inefficiencies in that system. Right?
Yeah. Yes.
I don't even know who it is, but I know it is. I don't even know who it is, but I know it is.
I don't want to dox them, but I know several groups that do it, but it is there's a lot of fights over what claims are appropriate and what are not. And many of those disputes, I think, could be settled in code. Or like, here are the reasons we're doing this claim, and you adjudicate that and settle it without any humans involved, and it's, you know, for 100 basis points, as opposed to the 20% we're charging now.
Right. Exactly. Okay. Now let's do a nice segue. Before we get into AI, let's talk about X402. Because I appreciate you talking about a couple of different use cases there, Vic, about like, why do we talk about Web3? Why do we talk about stablecoins? Why do we talk about these rails? And one of the reasons is because they're programmatic. As AI starts to do more, one of the things it's going to do is it's going to work with other AI. Agents will work with agents. And as agents work with agents, there is a cost there, right? There's a cost for the agent to operate, and then there's a perceived cost of the value of whatever the services that they're providing to each other. That's going to require some transfer of currency. X402 is a standard that is in place to allow two different artificial intelligence agents to engage in commerce and transact without any human in the loop. And we now have a convened X402 Foundation, which is a neutral space where competitors and payment methods can work together to create open standards for AI agentic commerce. So this is kind of, this is the future, right? We're going to have a space, just as e-commerce every year started to eat meaningful percentages away from brick and mortar retail. And now we don't even think about like how much of commerce is online commerce. That online commerce that is largely an intermediary between two humans is about to shift a meaningful percentage to agents that are transacting on behalf of humans or organizations, but independent of those humans and those organizations, and leveraging a protocol, perhaps X402, to engage in that commerce.
Yes, no question. I mean, I'll give you an example. I buy a bunch of stuff on Amazon every month because we use it, right? And I have not set up those recurring orders because I don't trust that Amazon's going to always be the best price. They usually are the best price, but I feel like if I lock in and I'm always buying from them, it sort of takes the motivation away for me to get the right price and for them to be most competitive. So I'm just nervous about that like programmatic thing. But I have a chief of staff. I haven't targeted Walter at this, but I buy the same things every month because I use them, whatever, like Tide detergent and just stuff like that. And that's one very easy to understand way that an agent could be acting on my behalf, but it would have to have some way to buy things, and I would have to be able to trust it, and then it would have to, so either it's going to go through Visa or MasterCard, which you just talked about, using stablecoins, or this is an open standard that would be, more independent and probably less expensive, but people will have to begin adopting it. I think we'll have both. I think we're going to have the legacy fintech systems sort of using stablecoins or 402, and then we'll have new startups and new companies that are providing this. And what's great about it is it doesn't have to be built. It's already in place in the way the internet is built now. And so we are using an existing set of protocols. And the reason it hasn't been used before is that, it is really most valuable when you're doing very small transactions. And so my example of Tide is probably not that good. It might be like to get my server costs. I only want to buy one day at a time because I may want to be bidding it out every day. And that seems like a hassle, except I won't be doing it. The agent's going to be just like holding a bid every time. So anyway, yes, that's where we're headed. And I think it's good for the healthcare audience to sort of understand this because we're going to be slow to adopt, but it's coming industry-wide.
Yeah, agree. Okay, moving into AI, we got 3 more stories. So the first one's from Axios. The headline is very simple. China just erased America's AI lead. And really, you could say, part 7, because this is not the first time this storyline is hit. The very first time was when DeepSeek was released, and we realized that China had the ability to create models that were competitive and that were going to be open source, and that weren't necessarily trained on the highest quality chips that we have access to here in the United States. So this is just a continuing drumbeat of China just continuing to eat away at the idea. It's a narrative that they're eating away at. The idea that the U.S. has a dominant, commanding lead in frontier models. Yes, you may release a great model and have it for 3 weeks, but you can expect, I think we as AI users can now expect that within a month of a big frontier lab release, China will have something that is free and is almost as good. And that's the storyline here. Kimi K3, a massive new model from Moonshot AI, is, for anyone who knows, Kimi K2, K2.5, K2.6, it's a swarm of agents model that is very, very strong at deep reasoning. And so them going to K3, meaning it's a whole new level to the model, is very, very strong. It's been vaulted to the top tier of global AI, apparently beating Fable 5 and GPT 5.6 Soul and front-end coding tests by AI evaluator Arena. It finished ahead of Opus 4.8. It's such a huge blow to the idea that these frontier labs have a durable business model, right? Like, how can they possibly have a durable business model when within a month of them releasing something, there's a free version out there that if we can figure out how to host it, we can run ourselves.
Yeah. I mean, I agree. I think it's over. I hope we can win, but right now, I agree. It's less than 30 days for China and anyone in America that wants to use Chinese models to get the same capabilities. And I know Anthropic has been most public about complaining about China distilling their technology. I do not believe that's real. Like, yes, sure, they are doing whatever. It's a very competitive space. So everyone is doing anything they can to get the best model, period, full stop. And China is certainly not above that. But I do not believe that if Fable 5 is the best cybersecurity thing in the world, they cannot tell that there's 10,000 servers in China hitting their servers every second. I just don't think that's real. I mean, I'm sure there is distilling going on, but that's not the main thing. The main thing is that they can't protect this IP. Once it gets out in the world, people see how it has been configured. China has access to much more power and much less expensive power. And so they have different architectures, but they're very competitive, and they're going to be competitive. And the way that America has won in other races is we don't stop. We keep innovating. And even though they're gonna copy our stuff, we have the next one and the next one. The challenge is that the models are getting so strong right now. I mean, I'm in the position right now where I cannot use the capabilities of Fable 5 or GPT 5.6. Like, I don't know how to use them right now. So I'm not utilizing all those capabilities. And I've upgraded to the new models, but it doesn't really change what I'm doing. And that's a real challenge to the Anthropic and OpenAI kind of business models. I think Google has a different business model. The Chinese have a different business model. I think enterprises that are much bigger than our enterprise are going to look at self-hosting various models, and eventually they're not going to want to pay for the same kind of API costs that the frontiers are charging right now.
Yeah, and organizations our size are going to do that because we're doing that.
Yes.
Like it's like we got to get to it in our long roadmap of things we're working on. So right now, like we're heavy Claude users because look, as a harness for an organization, it's very, very tight. And the minute you move to any of these open source models, they are very, very lacking in the harness category, right? Yes. So it's difficult to scale these models to a team, but Vic, if we get 3 months of like runway to really work on it, of course we're going to do it. We're going to do it. And by the way, we just talked about how it's not only China models, right? There's Nematron from NVIDIA. There's Gemma from Google. I mean, the thing that I think...
Yeah, Mira Moretti just came out with a model. I don't know if we should have maybe covered that story. But there's going to be all kinds of open source models.
Who came out with a model?
Is her name Mira Moretti? Is that how you say her name?
Thinking machines.
Yes. Yeah. The first product was tinkering, so you could, fine tune. And then they released an open source model, I think yesterday. I should have brought it to us, but it's not great. I mean, it's an average model, but I think they just wanted to get something out there that they could then, use for their tinkering product, and then people can own it versus sort of tinkering with the other models.
With the others, yeah.
But it'll keep everything's going to keep getting better.
Yeah, and also, like, I think we're going to have many, many small language models too. You know what I mean? That are going to be specialized for different use cases. I was talking to a guy who runs a technology company, and we're working with him on a portfolio company. And I was talking to him about, coding agents. I was talking about, I've been testing, obviously Claude Code. I've been working with that for months, but I've been working with Klein, the open source one. And I was asking about Cursor, and he was like, "Oh, Cursor is great." And the reason is because Cursor has its own configured fine-tuned model specifically focused on all the like little nits with agentic coding. And I was like, "Oh, it's like it caches certain things so that your PRs are very efficient. It's just tuned for that use case." And I just think we're going to see so much more of that, Vic. And by the way, like this is exactly what we were talking about earlier with drug discovery, right? It's like, I just think we're going to have all forms of models, and yes, the general models are going to be great, but the idea that they can hold on to the pricing power is not there, right? So it's not that their models are not ultimately going to be the best. It's that how do they justify the pricing power? I don't know how they do, right? In a world where we're going to have all these options. So,
yeah, I agree. I think the harness is becoming the differentiator much more. I mean, the reason I haven't turned it on yet because I have too many subscriptions I'm doing, but the Cursor harness is why Cursor. I mean, yes, they built their own model, and of course they're getting bought by SpaceX, so they're going to have a lot of compute, and their model was built even before that, so they're going to be really strong. But the reason they're strong is that they really focused on the harness first, and it's turned out that the harness is really the differentiator now, I think, in a lot of cases.
100%. All right. Meta is in talks to lease computing power to Anthropic in potential $10 billion deal. So this is now the second sort of, big capitulation. First, SpaceX with Grok. It's now Meta with Llama capitulating and giving its power over to Anthropic. So it seems that Anthropic is becoming very successful in aligning with these companies. And I think it's meaningful because it's not OpenAI doing this deal, right? And it doesn't mean Meta won't do a deal with OpenAI. I think we know that SpaceX will not do a deal with OpenAI. But for Anthropic to be continually first in line for these, big computing deals does seem pretty meaningful, and also seems like it could lead to alignment in terms of the integration of their models in these platforms. You can see how Anthropic might, Claude might make its way into, Tesla, or Claude might make its way into Meta products. So I would say this is sort of the other side of it, where Anthropic's core business model today, which is incredibly powerful and growing at levels we've really never seen any business model grow at, but they may end up finding some diversification through their alignment with these other organizations.
Yeah, it's interesting. I did not have that take on this. My take was that I think Anthropic does not have enough compute power. So I have subscriptions with both OpenAI and Claude Code, and the token kind of budget that OpenAI gives. It's a weekly budget, and OpenAI is just escalating. Like, here's free tokens. Here, we're doubling your budget. We have more and more. I can't use the tokens. Like, I literally have more tokens than I can find a way to burn.
Wow.
And Anthropic is not that way. I have hit I've hit the threshold where I get cut off several times. And Fable, they keep saying that they're going to pull it out of the subscription because it's so expensive to run. Now, they haven't actually done that. They keep saying they're going to cut it off on July 10th, and then they give us one more week, and then now it's one more week.
Right.
But I think they have very limited compute compared to OpenAI, and OpenAI is taking advantage and really sort of, being very aggressive in giving away, very generous budgets for the same, whatever, $100 a month subscription fee to, try to pull people over to them. And I think that's why Anthropic's doing these deals, because they have the users, but they're not able to serve them in the same way that their biggest competitor is. And so I think they're running quickly, doing deals like this to try to catch up. I think Anthropic will be fine, but they need the compute, I think, more than anyone else, which is why they're signing it.
I think that's a better take. So let me just ask you one other question about that. It's fair to say Anthropic needs to compute more than OpenAI. However, what you didn't quite address there is whether or not the reason they need it more is because their product is getting used a lot more. So than OpenAI's products are, and so that's a question I have. Do you think it's just purely compute versus compute? OpenAI has a better war chest for compute, or is it that Anthropic is just growing a lot more, has a lot more usage, and that's why they have to keep growing supply because their demand is better than OpenAI's?
I think that OpenAI invested much more 2 years ago, 3 years ago, 1 year ago in deals to get compute. Because Sam Altman believed that there was going to be 10x, 20x, 30x yearly demands on AI. And I mean, Dario is on record as saying he was more cautious about that. He didn't want to bet the company on that. And yet it has grown very quickly. And then I also think that Fable 5 is, really eats a lot of tokens, uses a lot of tokens. And OpenAI has not released GPT-6 yet. I think they're working on it. It will be the same class as Fable 5. So once they have that, maybe they'll have challenges. But Anthropic has been public about saying Fable 5 is a very token-heavy model. It's really powerful, but it also is expensive to run. So it's that dynamic. They didn't bet their company on the growth the same way OpenAI did, and that's a little bit put them at a strategic disadvantage. And then they came out with Fable 5, which has been an incredible advantage for them, but also put a lot of stress on their compute.
Great analysis. And I think your take is better than mine. I concede.
Well, I mean, okay. I haven't done a lot of research on it, so it's my off-the-cuff take, but I think it's something like that.
I disagree. Let me give you more credit. You use Codex and I don't. So
that's
you
true.
had that. Right. So you had that comparative practitioner analysis, right? That I didn't have. I didn't understand that. You have much more robust access to tokens on OpenAI than Anthropic.
Yeah.
So
you definitely feel it. Like you can't. I don't know if you've bumped into token limits, but on Claude, you can.
Oh my God.
Relatively easy, you can run into it.
Dude, all the time. Look, when I'm generating the show notes for this, like it'll be like, oh, Sonnet just hit a limit. We're bumping down to haiku. Yes, all the time I run into limits with Claude. It's like nonstop. It's so annoying.
I cannot use the tokens that OpenAI is giving me. It's just like they keep doubling it. We'll give you double tokens this week, and I think because they're trying to poke at Anthropic, but they have a brand differentiation that enterprise has really, and including us, have trusted Anthropic, and I feel the same. They have a great harness. The Codex harness is better than the Claude harness, but I don't trust Sam. I trust Dario to do what he does, which is frustrating at times because he does this fear mongering thing, but I think he's more careful with our data than Sam would be.
Just saying for public, we gotta get you, Jess, and I sitting down for like an hour and have you show us Codex, so we can really look at considering using it. I'm not a Claude Maxi, I think that. I'm trying to use all this stuff. I've used way more open source tools than I have used OpenAI. I'm using Venice, I'm using ClinePass, I'm using Olama.
I don't know ClinePass. Okay.
So Cline is an open source cursor, basically. It's a plugin for VS Code, and then they have their own hosting service that hosts, Kimi K2 and GLM.
So you don't have to hit OpenRouter or something.
Correct.
They have one. Okay.
Correct. They have one. Correct. Okay, last story. So this is MedCity News. The headline: former Mayo Clinic leader sues system over alleged AI cover-up. And I think the reason why I wanted to pull this in is not to kind of interrogate the story, because we don't know what happened here. Basically, a former Mayo Clinic research director claims that she was silenced and demoted and then fired for sounding the alarm on AI safety, inpatient privacy lapses at the health system. The reason to highlight it is because this rhymes a lot with stories that came out of big tech, specifically Google, from someone who I think had a very similar role there 2 years ago, right? And so I think these AI ethics sort of, AI safety stories first emerged just in the pure tech world. And it's like that world has kind of gotten past that. I don't know if they cleared everybody out who wasn't with it, or people are still clearing out of those companies who just, don't feel that they're philosophically aligned or ethically aligned with the direction of those companies. But we don't hear those stories as much anymore on the tech side, right? But I think you remember, these were pretty prominent stories at the dawn of this whole LLM, takeoff. But now the fact that we're seeing it happen in a health system, and I think Mayo Clinic is actually very important because Mayo Clinic is going to be a leader in this, right? I mean, they're an advanced health system, very, very strong in innovation, quite strong in artificial intelligence. And so to me, this is probably the beginning of of a whole line of these types of stories that will be rolling out in years to come, where we're starting to see a rift between the people who are hired to make sure that AI is being deployed in a safe and compliant way, and organizations needing to adopt AI, for all the reasons that are pretty plain and obvious.
Yeah, I agree. I think that it really is an institutional, cultural decision. Like, one cannot say that if you use an AI tool, there will never be a mistake that jeopardizes patient care. You can't say that. That is not possible. And yet the tools bring a lot of positive results to the delivery of care as well. And so there's some judgment or some institutional cultural decision that's to be made of how do we manage this powerful technology to reduce the potential for harm, or put checks and balances so that it's very, very unlikely to happen, and capture the upside, the benefit to productivity and patient care and our workforce being able to deliver more care. That is new. And how Mayo Clinic sort of internalizes that and decides, here's the line that we accept as far as risks because we want the benefit, needs to be decided at each place. And there certainly will be employees that, as that gets handed down from leadership, are not comfortable with their decision was made. And whether it was a cover-up or not a cover-up, I think every health system is going to have to decide that for themselves. And it's not going to be an absolute thing. These are not absolute technologies. So you cannot say we have done QA and it will never, violate the Hippocratic Oath and do no harm. You can't say that. You can put checks and balances in, and you can say we've done the best we can do, and the benefits are going to far outweigh the negative effects. But not every employee that signed up for Mayo will be comfortable with wherever they draw the line. And so as an industry, we're going to have to figure this out. And I think you're right. The tech industry, like usual, was 2 years, 3 years ahead of us on this, but it's going to propagate through the whole industry, I think.
Yep. I couldn't have said it any better. I think you've exactly nailed it. This particular technology, I was listening to a podcast recently with Gary Marcus, who's a big critic of LLMs, but also like a pioneer of artificial intelligence. So not just like sort of an uninformed critic. He's a very well informed critic. And look, he says some things in plain language that I do think need to be heard and understood, which is this particular technology, because of what it is, fundamentally, because of what it is, it's never going to be 100% correct. It's simply not. It's always going to have these elements of, what we've called hallucination, right? I mean, and hallucination kind of implies something that's not really right. It's just sometimes its predictions will not be correct. Right.
That's how it's architected. And you cannot get around that. Like,
no,
there is no way to solve that. Now, we, as you know, we're trying to work on an important thing in our sort of a compliance system internally around valuations and audit. And so we have structured this adversarial, putting one AI to review the other. And you can put things in place to make it less likely that, okay, are both these AIs going to have a prediction that is not in the normal distribution, kind of around the mean at the same time, where we have a flaw that causes a real problem in our system. The odds of two systems simultaneously having a hallucination is quite low, but it's not zero. It is possible. You can't say it's zero.
No, and because of that, we cannot abdicate responsibility or ownership over the final product, right? We can leverage AI for accelerated, work. We can leverage it for research. We can leverage it for a lot of things. But ultimately, we have to consume every word, and we have to edit, and we ultimately have to approve, right? And it's a tool in that regard. And so, yes, building systems, building harnesses, building evaluations, building deterministic wrappers, all these things are necessary with this technology. And when you're talking about health systems, you're talking about less mature ecosystems doing this work than the big tech players today. And that's a challenge.
Yeah, and as we use AI more and more, the humans have many more files to review for accuracy. And so, like, how are we going to have our people review all these things at the Mayo Clinic to make sure that it is high quality? Those are judgment calls that are going to need to be made. And I think there will be people that believe the trade-off is not right because that's just human nature. They're going to have different opinions about it.
Bonus story. Sorry. I can't believe I forgot this one. We have to include it. On X, Chamath Palihapitiya. This is his post from July 14th. I'm just going to read it. Here's the first case study of what 8090 can do. Working with CMS, Center for Medicare and Medicaid Services, our enterprise team decoded a 50-year, 18 million repo of COBOL and assembly that governs billions in healthcare payments. We documented 100,000 plus business rules in plain English using Software Factory, each traced to its exact source line. The people who own Medicare policy can now read how their systems behave and change as they see fit. Read the full story in the thread below. We can do this for any large enterprise who have big legacy code bases. So I want to bring this up. Why? Because I think it might have been a month ago when I was in National Harbor for HFMA annual, and Commissioner Oz was there, and he was talking about this database, Vic, and he was talking about the need to have innovators come and help them work through this COBOL. I'm fairly certain that Chamath was already working on this when he was on stage talking about that, right?
Yeah, and it's going to give the people that are running these groups, the executive branch and the administrators of these departments, much more clarity on what the systems are doing, which is a good thing. I mean, knowing how we are reimbursing through CMS is the first step. If we don't know what the systems are doing, you have no chance to make any changes. But then I think we're going to see the Oz and others in the administration then have much more power to be able to change things very quickly in a way that the industry has not been accustomed to previously.
And Chamath is the one who got to it.
Yeah.
And this to me is a massive changing of the guard moment. This is a really big changing of the guard moment that almost nobody in healthcare is even going to talk about. Mm-hmm. They're not even going to talk about it. But this is AI coming into CMS at the hand of one of the all-in besties and rewriting the infrastructure in a matter of mere months. What that signals to me is it's the beginning of the end of the healthcare industry as we knew it in the United States. That's, I could be reading too much into it, but I don't think I am. I think this is a story we've been tracking for so long. I think this is the talk that I give to organizations around the country.
Right.
And this was the punchline. This was the punchline, right? We've been talking about how all these payers are going to get out of government pay. We've been talking about how General Catalyst is buying health systems. Mm-hmm. And now Chamath's company is in there writing the new version of the platform that CMS is going to run Medicaid on. I'm out of fingers to point to where this is all headed.
Right. Yeah, I mean, it is the beginning of the end. And I think we have been talking about that since the first episode of this podcast. And it could be really bad. It could be healthy in the long run. It could be a lot of things. But people that actually know healthcare and understand how physicians think, how administrators think, how patients need to be cared for, need to pay attention, need to come to your talk, and need to get involved, because it's moving whether they get involved or not. And I think we need more people that have experience actually treating patients to be in the process shaping it.
I would say it's pretty far behind. So I think if we overlap how fast it's moving on one end versus the other, we're probably at a bit of a impasse now.
So you think is there no hope? You think there's no hope?
Well, I don't think it's about hope. I just think it's about acknowledging that we have a sea change that is very clearly happened, right?
Oh, I agree with that, definitely. And we're not going back.
Like it's happened. No, it's fully happened. That's it.
Yes.
Yes,
it's
that's
over.
what I'm saying.
AI is now running CMS, and the people that understand AI are running it. And
not some health tech company.
No, I mean, Chamath
the all-in guys.
Chamath is what he is, but he's not a healthcare guy.
No,
he was at Facebook. He came out of Facebook. I mean,
yes,
he's very smart, but I don't think he's not going to know anything about healthcare that he doesn't learn like as he's digging into this.
Yeah. I mean, he's smart. He's got a ton of resources. He can learn anything. I mean, I learned healthcare. Anybody can learn it. It's not impossible to navigate. I'm just saying it's not the usual cast of characters.
Yeah. Yes, definitely. And we're not going back. So no matter who wins the next election or the next election, you can't put the genie back in the bottle. Like it's already gone. We're already in the new world. We already have Chamath with a software factory. It probably has 10 people and a whole bunch of agents. And we have a software factory in Codex that I need to show you. It is really powerful, and healthcare experts or people that know healthcare well, hopefully need to come to your talk or listen to this podcast and begin to get in the game, because it's already moving.
Agree. All right, man. Next week we are in the office, right?
Yes.
Okay. Because next week is episode 200.
Oh, good. We'll be in the studio for 200. Excellent.
Episode 200 next week.
Yes.
Yeah. Let's see if we can find enough time to have some surprises for the show. But can't believe we've done 199 of these things as of today. Crazy.
Yeah. It's been fun. I've learned a lot in the process. Like, that's what I liked about it.
Yeah, I learned today. I didn't know about the OpenAI Anthropic thing, right? So that I'm always learning. So, all right, man. Well, look, have a great weekend. Enjoy the World Cup final, and I'll see you on Monday.
Yeah. Okay.